Hello, namaste. You are watching Khabarhub and this is Kavita Shrestha. So today we have Miss Emilija, country lead of Nepal from Project Hope. So today we're gonna talk about Project Hope as well, and also the pandemic situations of Nepal and crisis in this current context. So welcome to the Khabarhub.
Thank you. Glad to be here.
So how are you?
Good, thank you. I'm very happy to be in your country.
Thank you so much. And how do you see the current situations of COVID in Nepal?
Well, currently in Nepal and around the world, the cases of COVID are decreasing, but I'm very happy to see that the government and the hospitals are not putting their guard off. They're already preparing for the third wave, and both in terms of increasing the capacities of the hospital, but plus also requesting additional training for the medical professionals. So I do see that Nepal is handling this situation as good as they can, as every country in the world that is experiencing this pandemics.
And how do you see the people right now in this pandemic, as in working, and of course the local people inside Nepal putting their masks or not? Have you watched that?
Actually, we have different experience in different parts of Nepal. I was lucky enough to be able to visit other provinces aside from Kathmandu and other cities, of course. What we noticed is that in Kathmandu, the majority of the people wear masks. But as you go to the more remote areas, more rural areas, this is not the case. We tried to do a little assessment and question this, why this is happening. I would say it's both the awareness, but also the availability of masks for everyone.
So you said that in rural area, most of the people not wearing the masks, and they are not aware about the safety precautions as well. So have you all as an health workers, have you aware about the things about the safety precautions to the rural areas people?
We are working directly with the medical professionals, and we hope that through them we can reach the general population as well.
So during this second wave, as we are facing the second wave right now, so how do you see other international countries helping in this current pandemic and crisis?
From what we've seen, many countries have supported Nepal, and from what we've heard, of course, in our meetings with government officials here and with the doctors and nurses in the hospitals, I do want to say that additional support is needed from every country, and I would like to request that the countries that can afford support Nepal additionally, especially in the vaccination process, because this is something that has been a challenge not only for Nepal but for many countries as well. Knowing that the percentage of vaccination is somewhere below 3%, I think this should be something that Nepal should get assistance for very soon.
Okay, so how do you see the situation of hospitals and the health workers of Nepal at different places of Nepal?
I visited only a few hospitals in the province 5 in Lumbini province.
Okay.
So I cannot talk about the whole country, but I can see the dedication of the medical professionals working there, and also the efforts of the government and the ministries to support them. So we can just say that they should continue their great work.
That's nice. So what's the main missions of you and your team being in Nepal?
The mission of Project Hope is placing power in the hands of healthcare workers in order to save lives around the world. So this is how we started our activities and response in Nepal, with support of our partner Pratima Nema Memorial Foundation, to organize a training on COVID-19 even a year ago. We trained over 90 trainers with the TOT program, and then the training was disseminated for 1,800 medical professionals in the country on treatment and everything related to COVID in general. Additionally to that, we are just implementing a program to a training program for healthcare workers on vaccination and the vaccine process, and with a special focus on the resistance on vaccination for the general population. This has been implemented in the last couple of weeks very successfully. We have every day a couple of hundred participants, and we get very good feedback from them. So we do hope that this will continue to be implemented in future. Additional on that, with our partner Pratima Nema Memorial Foundation, we supported the procurement of medical supplies, protective equipment, oxygen cylinders, oxygen tanks for Province 5 for 12, all 12 districts in 13 hospitals, and plus I think 6 centers for isolation. This is what's been done till now. In the pipeline we have a shipment of around 80 pallets of medical supplies that should arrive in the country in the following couple of weeks. So we hope that this will be just the beginning of our collaboration and our presence here in Nepal.
That's very great to hear. And of course you have just said that you have been observing and you just know about the only one Lumbini province, only you haven't observed other district, other province. So what's your upcoming plan for other province also, or?
To be honest, while meeting, yesterday we had the opportunity to meet the Prime Minister and the head of CCMC, and we also met with the Minister of Health of Province 5, and as I said, with many doctors and medical professionals, nurses as well, and get their feedback. What we got as a request from everyone was to focus on the vaccination process and the availability of vaccines in the country. So this will be the focus of our mission as well. We are trying our best to be able to support this. I will use this week, since I will be here in the following week as well, to additionally maybe visit some of the hospitals in Kathmandu as well, and hear the needs from the people that are actually on the ground working with patients. But in general, I can say that we will focus on the vaccine process.
Okay, so what is the current information that you are getting from the discussions with the government?
As I said, the focus is vaccines and getting vaccines as soon as possible, because as we are facing a possible third wave and the Delta variants of COVID-19, we think that preparedness and how to say, the awareness of the management of the hospital, that they should be better prepared for the next wave, especially because they consider that children will be most affected. They also requested additional training for pediatric patients' treatment of COVID-19. So I am very happy to see that they are not putting the guard off, and that they are preparing to support the people of Nepal in future.
So how the government people actually respond on this vaccinations topic?
I can only say more about our efforts. I believe that the government is doing their best. It is a competitive process around the world, and we are experiencing challenges everywhere. So I can only say that we will do our best to support the government in this process.
So actually Project Hope is an international project.
Yes.
And have you ever thought about the Nepal also having the one of the Project Hope organization?
Actually, we are currently exploring options to open an office in Nepal and to be able to support the people of Nepal long term, I would say. It is strategically one of our focus countries at the moment. So I do hope that we will have a long-lasting presence in the country.
So Project Hope, actually we have seen like this current context, this crisis, this pandemic, you all are working for vaccinations and of course the awareness and other medical supplies as well. So beside that, any other helping hand you have seen in this current context, helping with you or supported by you or throughout with you?
We are planning in probably the next month to start the implementation of a program for mental health and resilience for healthcare workers that work with COVID-19. we have seen that the doctors and nurses working in the hospitals are already exhausted, and we do believe that supporting them will allow them to do their job even better in future and strengthen their capacities. So we hope that this will be very well accepted by the medical professionals. This will be done again in partnership with Pratima Nema Memorial Foundation on a country level, not only in specific provinces. So this is something that is confirmed, but we hope that in future we will be able to focus on different areas, because Project Hope is an international organization, as you said, and we work not only on disaster response and preparedness, but also mother and child health programs, non-communicable diseases, infectious diseases, and we do hope that many of those programs can be implemented in Nepal, of course, depending on our supporters as well.
So right now, as you have also viewed, I think like this flood and landslides are going on the Nepal as well. So how do you see the situations and helping hand for this context?
As we met with the head of CCMC, this was also one of the topics mentioned. And one of the strengths of our organization is disaster risk reduction. So we hope that in future we will be able to focus on this area as well. For now, as we all know, COVID-19 is the priority, but we will not stop there for sure.
Oh wow, that's very nice. So at last, what kind of recommendations would you like to give to the general people?
To the general population, I would just say that the doctors, the nurses, the medical professionals in the hospitals are doing their best, but we need to help them by protecting ourselves, by wearing masks, keeping social distancing, and I believe that that's the only way that we can support them, so for the overall benefit of the population of the country.
So at last, do you have anything to say?
Just thank you for the invitation to come here in Nepal. It has been a pleasure, an honor and a privilege to be here, especially during these hard times, and I hope it won't be my last time. Thank you.
So thank you so much for your time.
Thank you very much.
Thank you.